This afternoon, we'd like to do a procedure called posterior chest examination. So posterior chest examination is just a piece from physical examination. Physical examination starts from head to toe, but then we want to just pick a portion which you can be examined on, which is posterior chest. So when we say posterior chest examination, it means that we want to examine this part of the chest, okay? So this part of the chest will be examined alone. So you can do head to toe examination, but then you can just isolate to say that perform posterior chest exam. So when performing posterior chest exam, you're going to do the 4 techniques that you have learned. The 4 techniques that you have learned to use are inspection, percussion, palpation, and auscultation. So these are the 4 techniques that you are going to use. So this is how you do it. You have to go to the patient and ask permission. So in this case, you can use your hand sanitizer. You have hand sanitizer. Then come to the patient. Good afternoon, Stanislas.
Good afternoon, sir.
Okay. I've been assigned to do posterior chest exam. Is it okay if I perform the procedure?
Yeah, you can go ahead.
Okay. Is there anything I can do for you before I begin the procedure?
Nothing.
Okay, so the patient has said that nothing. Now I have to explain to the patient, because when you are doing this procedure, you need to see the patient's back. So in this case, he has to remove the extra maybe shirt he has or jacket, so that at least maybe remains with a vest, so that you're able to see. But if there is enough privacy, even the vest can be removed, so that you're able to see the skin, the breathing pattern, and all that you need to examine. So I would like you to remove the shirt so that you remain with the vest, so that you can really examine the back. Okay, so in this case, at least I'm able to see the back. Okay, but then with enough privacy, you should be able to remove even this. Okay, so what you do now, when the patient has removed the vest, you're going to start with inspection. So with inspection, what you're going to do is you want to start with the respirations. You want to check the rise and fall of the chest. So how you get to see this, you stand back and then compare the movement of the chest. So you can be able to see the front, meaning the anterior chest, okay, movement, even the posterior chest, how you can be able to see. So you start with the anterior chest to see the rise and fall. So this you're trying to check is the patient tachypneic. Okay, is the patient tachypneic, meaning that is the patient breathing very fast. Okay, so and the type of respirations the patient has. So at this moment, I've assessed the type of respirations. Okay, the patient is having normal breathing pattern. So now what to do under inspection is just to see. So since you have said that the patient has to remove the shirt, you should be able to at least see the back. Okay, you should be able to see the back and be able to check. So as you stand behind, you assume there is no vest. You should be able to see the skin. Is there maybe a rash? Are you able to see rash? Are there sores? So if there are sores, you should be able to report to say, okay, there are sores, or there's rash, or if there's any deformity, you should be able to say, okay, there is any deformity that you have seen. Or if you have seen any abnormality such as rash, growths, or something that is there, rash or scars, you should be able to report scars, rash, any deformities, any growth, report to say, okay, there is that. That's under inspection. So since you're inspecting, you're just using the sense of sight, just looking. Okay, that sense of sight. You have to move on to go to palpation. Okay, so under palpation, you want to use the sense of touch. So you need to touch. Okay, so you want to touch like this. When you're touching like this, you want to at least feel, is there any growth there? Then as you do this, look at the patient's face. If there's any tenderness there as you palpate like this, the patient will be able to at least change the face, meaning facial expressions will change. So do that, okay? Feel for any growth so that at least you're able to elicit if there's any abnormalities. Okay, so then you have to look at the patient's face. The patient's face will change, okay, meaning facial expressions will tell you that there is tenderness. So from palpation now, and there's another part which we consider under palpation, which we call tactile fremitus. Tactile fremitus. Get to fundamentals, you'll find it. It's called tactile fremitus. So under tactile fremitus, you want to get the movement of air. So movement of air has to move from the lungs to go all the way into the respiratory tree and go at least outside. So I want to know, is there good air entry? Okay, air entry, or is there good expiration? So those vibrations that we call tactile fremitus are just vibrations. So when you put your palms like that, okay, meaning that when somebody is able to speak, sound comes from the lungs. So as somebody speaks, you should be able to feel the vibrations. So if you can't feel the vibrations, say this side, meaning there is no good air entry or there is no good air movement, there may be an obstruction this side. So when you put your palms like that, then ask the client to say blue moon, or they can say 99. So Stanislas, would you please say 99?
99.
So with a low tone, 99. Say 99.
99.
So you're saying 99, I'm able to feel the vibrations, so you can practice this. So say 99.
99.
You move, say 99.
99.
Say 99.
99.
So just like that. So you should be able to feel the vibrations. If you are not able to feel the vibrations on one side of the chest, meaning there is an obstruction, so that's what we call tactile fremitus. So this is just vibrations that you're able to feel. So it's under palpation. So I've done your inspection, your palpation, okay, and then from palpation you go to percussion. So percussion is just the sound that you get. So in this case, air-filled cavities should give you a tympanic sound, okay, or timpani or resonance. So in this case, you should be able to put your fingers there, okay, and then get these striking fingers, okay, and place there, okay. So at this point now you should be able to hammer. So you should be able to elicit a tympanic sound. So you do. So you should be able to get that sound. That's air filled. Then you go this way, the same, this side, you go this side, okay. From there, you go this side. Have you seen this part? Okay, so this here, then there. Okay, so there. Okay. So if there is fluid, the sound will be very down. Okay. So you can even instruct your patient to fold the arms. You can fold your arms so that at least, and then move your back so that at least you are able to get a good sound. Okay, you can do that. Okay. Then from there, okay, you went there. Okay. Now from this side there, then you go where the chest ends here. Okay. So the chest ends there, so you go this side here. Okay. Okay, then this side. So there are 6 spots that we have percussed here, there, and this other part. So there are 6 spots. So this is called percussion. Just trying to get the sound. In case there was water, which we call maybe pleural effusion, you're going to get a very dull sound. So that can be called pleural effusion. Now in this case, you have done percussion. We go to auscultation. So under auscultation, you're going to get your stethoscope and be able to get the air entry. So we just want to know, is there good air entry or not? So you should be able to ask the patient to breathe in and out. So let's get it. So the same spots for percussion, the same spots. We'll go 3 this side, 3 this side. Okay, so we go. So Stanislas, you should be able to breathe in and out, okay?
Okay.
Yeah. So just ensure that the stethoscope is not too cold for the patient. Okay. So when I say breathe in, breathe out, you do so. So you should be able to test the stethoscope as well. Okay. So we go. Breathe in breathe out. Okay, so go this side, breathe in, breathe out. Okay, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Okay, so those are the spots, 3 this side, 3 this side. So those spots are able to get the air entry. So here there's a vest which is acting as a barrier, but then you have to instruct the patient so that even the vest is out, so that you can be able to get a good sound from the lungs. So that helps us to know, is there good air entry or not? So that's the purpose. We have to just elicit if the patient is able to breathe well or not. So this procedure is just like that. So it's inspection, percussion, palpation, and auscultation, meaning it's done. So Stanislas, thank you very much. You can put on your shirt.
All right, thank you.
Okay. So at this moment, I would even go to the maybe the examiner or the in charge to say that the exam is done, and also that I've finished doing the procedure, and the procedure is documented, and the patient is left comfortable. Okay. So just practice so that you get to know what you're looking for. So thank you very much for watching, and subscribe for free.